Talk or not yet? All right.
Yep, it's on.
All right. Welcome, everyone. So thank you for attending our first assistant physician license event for American Society of Physicians. I will have Mohammed start by introducing himself, and then we'll have Caleb and Walia, and then I will finally introduce myself. All right. So go ahead, Mohammed.
Hello, everybody. Thank you so much for having me, and thank you for inviting me, Henna, to the event. I'm excited to speak with all of you. A little bit of background. I'm an IMG by background. My name is Mohammed Khalif. I also serve as the Executive Director of the Washington Academy for International Medical Graduates, which is a nonprofit organization, 501c3 in Washington State, that is working on policies to promote for international medical graduates, and also, all unmatched folks as well. So we work with a lot of folks in Washington State. I'm also on the board of the American Society of Physicians with Henna, trying to build a larger coalition, and Walia, to build a larger coalition to help unmatched graduates in the country. Also, I am a member of NAP, in the assistant physicians as well. So I'm excited to, participate in all areas to, see how we can bring change to the system. So really excited, and thank you for having me.
Okay. My name is Caleb Atkins. I am from upstate New York. I actually am an MD by degree, and I have the AP license, a part of NAP as well, and I have a PA license from Puerto Rico. So I have MD, AP, PA. So it's kind of fun. But I am the Executive Director of Alliance of Medical Graduates. We're also helping unmatched folks. You can find us at Alliance of MG on Twitter. And I'm here to help with just my journey. So I actually went to Missouri and worked as an AP for a couple months. And then I moved down to Puerto Rico. I got the PA license, and then I started in Internado, which is a non-ACGME accredited residency. And then actually I just recently matched into family medicine in New York.
So I'll go next. I'm Walia. Sorry, my name says Jordan there. It's my child's name. So I'm also one of the co-founders of American Society of Physicians. And just a little bit about me as well. I'm an IMG. I went to school in the Caribbean, and, definitely went through the match process a few times, like 3 times to be specific. I matched on my fourth try last year, so I'm a PGY1 at Howard University Hospital in DC. But I'm definitely really passionate about, what we can do to help more people match into residency, and while they're waiting to match, also kind of have something to do to keep their experience just clinically, keep them in the clinical field of some sort. So I'm happy to be here, and I'll just let me know if you guys have any questions specifically. I'm happy to answer that as well. But nice to meet you guys.
All right, thank you. And we'll have Ranbir now introduce himself. He had some tech issues, but we're glad he was able to get on. All right, go ahead, Ranbir.
Can you guys hear me? Can you hear me? Oh, okay.
Yep, we can. Yeah, we can hear you.
Cool. My name is Ranbir Singh Sandhu. I currently live and work in Yuma, Arizona. I'm actually at work right now. And I graduated from a Caribbean medical school also a few years back, and I've been struggling to match. Passed all the steps already, and actually was key in getting our legislation for the medical graduate transitional training permit here in the state of Arizona, which I currently just started working as with my current place of employment. So still a lot of things that we have to adjust and fix with this licensure, but foot's in the door, and now we just got to kick it open.
Can you guys hear?
Yes.
Okay, you can hear me? Good.
Yeah, it's breaking
All
a little
right.
bit in and out. So, but I'll let you know
Yeah,
if it
it's
kind
probably
of shuts off.
my
Yeah.
Wi-Fi, but hopefully it's fine. So my name is Hennasani. I am a co-founder with Mohammed and Walia of American Society of Physicians. I have worked as an AP in Missouri. I do have the medical graduate transitional training permit in Arizona. I also have the IMG permit that was recently extended to IMGs in Illinois, and have the house physician license in Florida. So I've gone through all the applications for that. I've also know about the Utah license and looked into the Arkansas one. So I graduated, as many of you know, 4 years back. I went to a UK medical school, tried my hand at residency and couldn't get in. So now looking at a different path. But this AP license or any other permit or license has been very valuable in allowing people in our position to actually practice and under supervision and with guidance, and actually feel like your medical education is put to proper use. So even if you can't get a sustainable job at this point with it, it is really valuable experience. It may not be long term, but we're hoping with ASP and AMG to make this a long term and viable option. It has some hiccups along the way, and I'm going to have Hamid and Ranbir talk about the process of introducing it in their respective states, which I'm also trying to do here in California. So there's a lot of potential for it, but it's something that we can all utilize appropriately. And then I'm also going to have Caleb talk about his experience with the internado in Puerto Rico, because that's another option to practice this time. So from that, thank you everyone for introducing yourself. What we'll do is I will start with talking about the application process. So just to give a general overview, all the licenses are extended to MD, DO graduates. There are only 2 that are exclusive to MD and DO graduates. That's the Utah and Arkansas license. Arkansas is even more specific, where you have to be a graduate of an Arkansas medical school. So if we have anybody that falls under those restricted parameters, you're eligible for those. So that's American graduates for Utah, and then Arkansas medical graduates for Arkansas. For the AP license and for the Arizona permit, it is extended to everyone. You have to have completed step 1 and 2. If you are an IMG, you need to have ECFMG certification. The only difference between the application process, as far as I saw, between the Missouri license and the Arizona license is Arizona wants proof that you applied for match and were rejected in some way. So a rejection letter or NRMPs saying that you did not match, some proof that you're still actively seeking residency. Anybody want to correct me with anything I've said so far or add any additions? No? Okay. And and one thing that's good about the Arizona license permit and the Missouri AP license is these licenses can be issued prior to you getting a position. So they're not active, meaning you cannot practice until you get a collaborative physician to join you. But you can have a physical license or permit that says, hey, I can practice, I just need someone to hire me. So that's a general overview of this. I know a lot of you are asking for links for these licenses. So I would really encourage you to go onto our Twitter, because all the links are posted on a post, and it was also made into a thread. So you can access all these licenses, the applications, and look at the eligibility. And so those are the general licenses there. So the Florida House Physician License. This is the oldest license that has been given to medical graduates. It's a longer process, and it is more expensive. So it's a couple $100. You also have to do a physical background check and fingerprinting. And before they give you a license, you have to get hired. It's very hard to find positions because they're limited to surgery a lot of times. And you just have to be very proactive in that. However, what's one good thing about it, after you worked for a year, you can apply for area of critical need license, where you can work in a hospital or area that has high need for physicians and practice there. And that's usually 1 year after working as a Florida house physician. All right, and then let's see, I've gotten next is the Illinois medical graduate, international medical graduate permit. So this is the easiest application. You just fill out the sheet, send it, and I got mine in 24 hours. This is different in that you have to have completed step 1 through 3, but you do not need to provide any evidence like your ECFMG certificate or anything like that. What you do, you just fill out the paper and send it to the email. This is active right now until May 31st, 2022. Unless they extend it due to COVID, the need for COVID relief, really you can only use it until then. Finally, the Washington MD clinical experience license. So this one requires you to have step 1 through 3 as well. It is fairly new, and you need to work. I think Mohammed will go more into the nuances of it since he worked on it. But this is so the Illinois license and the Washington license are where they differ. They're only for international medical graduates that have completed step 3. So that's the basic overview of all of those. All of the applications require your board scores. Some require your diploma, ECFMG certification for an IMG. Some may require, like the Arizona license, proof that you're actively trying for match. So looking at the eligibility requirements, that you have to look at your own situations for that. Any questions or anyone else that would like to add to what I said? I went really quickly. Yes, Caleb.
So we just had an AMG
Sorry,
meeting. We meet every 2 weeks, and it got brought up tonight that you can use your AP license from Missouri to get the area of critical need license as well. So you can actually use these licenses to leverage into other licenses. I'll get into Puerto Rico and how you use your Puerto Rico license to get into area of critical need later, but I just thought it'd be a good to mention that it seems like the area critical need license is accessible using the AP license. I don't know if you mentioned that.
Okay. I didn't. Thank you for adding that. Okay. All right. So one question we're getting a lot is if these sponsored visas of any sort. So the licenses itself do not sponsor visas. I don't know if I think the only requirement is to be authorized to work in the U.S. I don't know about citizenship or if you have to be a permanent legal resident. Do any of you know about that? I know Washington's requires the 1 year of residence, but otherwise I'm not sure.
Yeah, Washington requires that you live in the state for at least 1 year, and visas, the state won't issue a visa. It just depends on if an employer, you're working with wants to like sponsor you a visa. I think that's the only difference.
Yeah. So one question we're getting is if you can use these licenses to work in other states. I don't know. It hasn't worked yet if anyone has tried, and I don't think they will because these are not federally recognized licenses. They're only recognized by each state. And that's the difficulty with this is we don't have a national license for medical graduates. It's only each state that it extends the license to that particular group. All right. So that's the application. Really, so I know people are asking if you need original copies or photocopies, so that's dependent on each application. Whichever state you're looking at, read carefully what they require. most may need you to directly send your USMLE report or have your school directly send a copy of your diploma or transcript, or they may even need you to get things notarized. I know one state needed, or two of the applications I applied for needed me to physically go and get things notarized. So look very carefully on those applications. Usually there's a checklist for each. That helps a lot more than reading through each application. All right. Before we go into job opportunities, I wanted to explain the process and how he passed Washington. And then
Hey, Hannah, you're breaking up just a tiny bit. Your line is breaking up a little. It's in and out a little bit. Let's see. Let me try again. Say,
there.
no, it's still breaking up.
Check the chat.
Oh Lord. Okay.
I can answer some of these questions that I've seen.
Right. If any of us, yeah. So if there's anything, I mean, as far as I'm concerned, I also applied for the AP license in the past, and it was pretty straightforward. I put the link on that on the chart. It comes with instructions and all the requirements, almost like a checklist. And if you kind of go through it one at a time and able to kind of provide all of that information, I think it took me about 3 weeks to get the license. At that time, and this is for the Missouri license. Trying to think if there's any other specifics here.
I'm seeing a question about Arizona. Is there a year of cutoff for year of graduation? No, there's not. So, like AP license has a cutoff of 2013. I think it's like I just made it, but Arizona doesn't have a year of graduation cutoff. All you need to do is show them that you are applying for the match and you through rejection letters.
Yeah. All right. So let me talk about, Hannah wanted me to talk a little bit about the Washington State license. First of all, if anybody is an American medical graduate here, like AMG, and if you've been out of school less than 2 years, please let me know. I actually have a friend in Utah who's trying to hire somebody for the Utah AP license. So the AP, unfortunately, the AP license in Utah was recently changed to only AMG. So if you're an AMG, graduated here from the United States and have been out of school less than 2 years, let me know. And I can connect you with my friend who owns a clinic over there. So, and you can contact us by having the ASP email below. And I think Hannah will post the ASP email on the chat. With regarding to the Washington State license, so the Washington State license is fairly new. We actually got the license issued first in November of 2021. And currently we have 3 people who have the license. So the license requires that you lived in Washington for 1 year, you have to be an IMG. And we wanted this to actually be open to everybody. But unfortunately we had a huge pushback from the Washington State Medical Association, who did not want, AMGs on the bill. So we had to make some compromises to that. But if anybody knows and their pushback was there was no unmatched AMG in Washington State. So if anybody knows any unmatched AMG in Washington State who lives in Washington State and is a resident of Washington State, please let me know and connect me with them so we could include them in the bill as well. So basically that you need the 1 year residency to live in Washington State.
You were muted.
You're muted again. You're muted, but I think you touched your mute button.
Okay, can you hear me now? All right. And you need to live in Washington for 1 year, and you need to pass all the steps of the USMLE. And also you need like it's called a sponsoring entity. So you need a job first, and it can be from a hospital. It can be from a private practice. All the physician needs to do is, like, the owner of the private practice needs to send a letter to the medical board saying that, hey, I want to sponsor this person to be hired in my clinic. And then you could start the work right away. The good thing that I like with the Arizona bill as well, and we did in Washington, is it's included in the physician statute, right? So basically it's considered as a physician in law. The only basically issue that, I think like the AP license in Missouri has is it's a separately new profession. So that kind of like makes a problem with Medicare and getting credentialed and all that. But we actually spoke with some CMS representatives a couple of weeks ago, and it said actually it's illegal for CMS or any health insurer to deny a physician or a healthcare provider licensed in a state reimbursement. So it's all about just enforcing that. And Ranbir and Caleb, I can send you that law as well. Maybe we can work together on that reimbursement piece, because that's something that we're working here in Washington State. We've showed that to some entities like Premera, Blue Cross Blue Shield, and they were really great in working with us on this to get people to reimburse for their services. So we successfully got 3 people working with this license, and we're continuing to try to get more people in this license as well. So, but I think, this mission of trying to create a pathway for unmatched grads or any physician who has the skills is going to take all of us. It's not just, like Ranbir is doing things in Arizona, and, we just got to let Arizona figure it out. I think we have to all be together and find a way to, break through the system together. So, and I think this will also help you guys, if you guys could reach out to your legislators, know who your legislators are, right? Talk to them about this issue. Talk to them about what other states are doing, because sometimes legislatures, when they hear about a policy that's not in their state, sometimes they get excited. Like, hey, what's this policy? Why it's not here? What isn't? A lot of people didn't know what unmatched grads were when we started advocating here. They didn't know, what residency was. So I think it's up to you guys, if you're in California or if you're in Idaho or if you're in Louisiana, to kind of meet your legislatures, speak with them and talk to them about this issue as well. And I see that we're getting some questions here. Year of graduation. So there's no year of graduations for Washington State as well. You can just, all you need to do is just pass those steps. And yeah, so just basically, all you need is to be here in Washington State, and we're trying to get rid of that as well. That is something that we did not choose. We got a huge pushback from the physician lobby. A lot of physician lobbies are not in favor of this, these alternative pathways for unmatched graduates. So that was not in our original bill. So that was something that we had to move through as well. But eventually we want to get rid of that. We want to get rid of a lot of sections in that bill to continue to make it more accessible to the community. And I'll just pass it on to Ranbir to talk about how his license in Arizona was passed and some of the tips that people can do in advocacy in their own state as well. And then maybe Caleb can talk about some of their advocacy efforts.
All right, thank you, Mohammed. So the Arizona Medical Graduate Transitional Training Permit, we are still in the infancy of this licensure. It was just signed into law, into legislation this past summer, 2021, by our Governor Ducey. And so most of us, around 66 of us right now that have this license. And one of the main rules with this license is you must have a collaborating physician in order to practice with this license. So out of the 66 people that have this license, I was looking on the Arizona Board of Medicine website last night. There's around 7 to 8 of us that have a collaborating physician. We have met some resistance with that. And as like Mohammed mentioned, just educating people and healthcare organizations on this licensure is pretty important. A lot of people do not know what residency is, as Mohammed mentioned earlier. They just think we graduate med school and you start making a lot of money and playing golf. So that is not the case. So I've contacted organizations, for example, like the Indian Health Services. They're a huge organization in these border states, especially New Mexico, Arizona, Texas, and they were not very receptive to hiring people with this licensure because of reimbursement issues. You know, we can't have an NPI, we can't have a DEA number at this time. So our goal, along with the bill of writers, with the American Association of Physicians and Surgeons, is just to get people at least working in this licensure over the next year to 2 to 3 years. And if we can show that, you know, we actually are productive members of the healthcare team, that we're contributing to more patient care, especially in rural areas, we might be able to, you know, add changes to the licensure, add, you know, potential bills to make these small changes. So right now, our biggest issue is just having people, you know, educating other people on our licensure and what we do. I kind of lucked out because the company I work for is in a designated rural area. We have outpatient clinics, we have urgent cares, and I've been working here as an urgent care manager for 3 years. So having that connection really helped me out. I know there's a few other licensees in Phoenix. They had a family or friend connection that hired them, and they are currently working. One issue that I did come across was that some of our licensees were willing to work for free, were willing to kind of do MA type work, medical assistant type work, and I stood strongly against that. We've had multiple issues where attending physicians would hire people like us as MAs and then pay us barely minimum wage and just kind of use and abuse us. So I encourage you, do not get this licensure and just think, oh, I'm gonna go volunteer with it or any kind of like bullshit like that. We work too hard to get this licensure from where, you know, to where it's at. So as Mohammed, excuse my French, I'm very passionate about this license. But as Mohammed mentioned, yeah, you just need step 1, step 2 done. If you're an IMG, you will have to show ECFMG certification. Just have it. You should have that done already while you're applying for the licensure. One of the main drawbacks of this licensure is you can only work in this position for up to 3 years. And each year you have to reapply for the permit, for the license to continue practicing. When we, with our state senator, Nancy Bartow, presented this license 2 years ago as a kind of assistant physician / mid-level provider type license, the Arizona Medical Association did not like that. ACGME has a big hold on getting every MD-DO to go through the residency process. So it was very hard to kind of navigate around that. So we had to, you know, give some concessions, and one of them was to make this a limited time license. So at this time, you can practice in this position for up to 3 years, but after that, if you don't match as of now, then that's it. Your career as a medical graduate transitional trainee is done. So our goal right now, in fact, I'm actually, we're going to be meeting the American Association for Physicians and Surgeons on Sunday, along with Caleb in Phoenix. The goal right now is just to educate as many physicians as possible, hopefully create a database of physicians that are willing to hire us, you know, for decent pay and education, just to kind of keep us in the loop, keep us clinically active. And, you know, it should be a license that should help you, hopefully enhance your chances to get a residency position. And if not, hopefully we can extend the time from 3 years to 5 years, maybe to 10 years, or eventually make it an actual mid-level type license. So that's my spiel.
Yeah, and I just want to add to Ranbir his comments that, you know, yeah, please don't work for free. You know, we've been talking about this with our members as well. You know, if we wanted to work for free, we could get everybody jobs, right? The reason that we're kind of like we only have 3 people working right now is we're trying to get people to work, right? And work means, you know, money. And, you know, this is basically, you know, you can't support yourself. I know a lot of people thinking, hey, I can get working for free, get a nice letter of recommendation, and maybe apply for residency. But you're actually hurting the next person that's coming behind you, right? Who doesn't have that luxury to, you know, do this for free and support their family, right? So, and I think, you know, we should all be mindful to like not work for free. That's that's just what I wanted to say, and I'll pass it over back to Hannah, I think, or the next person, Caleb.
I wanted to ask Ranbir, how are you billing? Do you have an
So-
NPI or
No, so there's no NPI, no DEA. Basically, and if you read the statutes on the actual licensure, any billing will be under your collaborating physician. So yeah, you can sign charts, you can sign everything, but as soon as they send medications to the pharmacy or when they finalize the charting, your name will be there with your collaborator on top.
right? They have
So-
to attest. That makes sense.
Yeah, as of now. So hopefully, hopefully we can change that. That was one of the things that the Arizona Medical Association, they didn't want us to have that kind of freedom, you know. But baby steps, we'll get there slowly.
That's just great that you're able to function like that. Awesome.
All right, thank you. Mohammed discussing about how the licenses work in each state. So we do have a lot of questions about salary. Can you all hear me okay, by the way? Much better? Okay.
Much better.
Sorry. Thank you. The internet is really bad here. So there isn't a set salary, unfortunately, for each of these licenses. I know there is a physician that is working actively in Massachusetts to create a grading system for, like, if you are first on a license or second year increase, and that would be an opportunity to make it a national license. I know Mohammed is trying to work at the federal level to find ways to incentivize states to pass this kind of license so that this is open to everyone that goes unmatched and not just for the few states that allow it. I would like to reiterate that you shouldn't really work for free. There are volunteer opportunities and like free clinics, and I have done that, but it's best to try and have these collaborating physicians pay you in some way, because they'll probably hire NPs or PAs or any mid-levels for their practice anyways, and they won't work for free. So we shouldn't have to, you know, struggle in this residency limbo kind of situation just to get LORs. And hopefully this can be a pathway for a lot of other people to get board. It's very new though, so don't expect this to be a way to do residency without match at this time. It is something we can look to in the future as an innovative idea, but not at this time. Right now, it is a way to get clinical experience, paid clinical experience, and hope to get you into residency. And if not, have something as a backup where you can continue practicing and utilizing your education and credentials in a clinical environment. So unfortunately, we can't tell you how much it pays. There's some that are really good and some that, like, I was working 16 and more in urgent. That was because I had another job and I was trying to get experience, wasn't looking for money. But there was another physician that was hiring for 40 an hour or 25 an hour. And some people opted to work with them because they needed that. That was their full-time job. So it depends on your situation and what opportunities are available at this time. There's not much we can talk about in terms of salaries, unfortunately. So I know we have a question about, can it be done at places that have residency programs? So Florida physician, the house physician license, you could. There is opportunity, but most of them do not. I think Larkin is probably one of the bigger ones, and Oregon and a couple others. So you can. The Missouri license doesn't allow you to do that because it has to be mostly in primary care and underserved areas. So that limits you from working in a hospital. But the physician may have a connection in a residency program, things like that. Sorry, was it Caleb that had something to add, or sorry, someone had something to add?
I was gonna say, I'll put it in the chat. The House bill we all need to support is House Bill number 2683 in Missouri right now. This will actually create a workaround to the residency bottleneck. So after 5 years and a number of residency-like training requirements, you can get a unrestricted license. This bill has not passed. This bill has been read twice in the current legislative session. It needs our support. If you're in Missouri, make sure you write to your House rep to let them know that you want this legislation to pass, that you're unmatched, you're unable to help in underserved areas, and that if this workaround was created, that the thousands of medical graduates that go unmatched every year would have something else that they could actually put their future into and their full effort into.
You can all do, but just like what
You're breaking up again, Hannah. You're breaking up a little bit. The mic's down. I'll step in and go over. I'll step in and go over the PA license in Puerto Rico, the internado, and how you can leverage that into working in the U.S. So I came down to Puerto Rico in June of last year for a visit. Then I came back in September. I applied for the PA license here. It cost $750 from start to finish. It allows you to work in the inpatient setting. You can work doing peri-surgical, inpatient work. You can also work outpatient. My girlfriend, she actually works inpatient at a hospital, pretty much like she's an internal medicine provider. She came from Dominican Republic and had, they put her to work using a PA license. She was actually a general practitioner before she got to Puerto Rico. So she had that experience and that training, but those inpatient opportunities are possible. And remember, inpatient experience and clinical work is going to really improve your residency application. So I saw a clear pathway, PA licensed internado. I thought it was going to take me a while because my Spanish isn't great, but I applied to an internado. People encouraged me to apply to internado, and I did apply in November, and I actually was interviewed December 15th. The interview went horribly. My Spanish was bad, but on the 16th, they actually offered me the internado position, and I started that in January. And after you've completed your internado, you'll get a general practitioner license, which you can then use to get the area critical need license in Florida, which pays somewhere around, six-figure range. I do know that the house physician license, I heard from my earlier meeting tonight, pays about $20 an hour, just for those who were asking that question earlier. Or you can use that general practitioner Puerto Rico license. I think I said to work in Puerto Rico. It works in Puerto Rico, so you can be and you get paid the same as family practice down here. So you'll make around $100,000 a year. And you can work for VA. So you can work with a number of VAs in kind of the states that have physician shortages. So like Oklahoma, Wyoming, West Virginia, this general practitioner license can get you in there as well. But it's a great way. It's a pathway. I like to say it will reset your year of graduation if you're an old grad, because you have that recent clinical experience. The only drawbacks are you need to move to Puerto Rico, and you pick up and move here, because they're not going to interview without it. And they're not going to give you an interview without being here. And you need to have Spanish that's good, pretty good, moderate. I got it with beginner to intermediate. They didn't really like it too much when they figured it out. So just try to have the best Spanish you possibly can. Spanish with Paul is a great resource. Read medical Spanish textbooks. There's a number of ones that you can find online if you're considering it. And good luck. That's that. And any questions, happy to answer.
Yo, Caleb, so was the entire interview in Spanish?
Yeah, and I had to, I didn't break from the Spanish, man. I held it. Even
All right.
even if I had to wait, I had 30-second pauses where I was trying to figure out the words, but
That's okay.
I stuck with it and got it.
Now, the majority of the patients you see, I mean, I'm assuming, are Spanish speaking, but I mean,
Yeah.
with Puerto Rico being a U.S. protectorate, do patients also speak English? Or
So I'd say about 50% of the patients speak English, but yeah, that patient interview is really crucial. But the more you do patient interview, like I can do a patient interview like it's nobody's business now in Spanish because you're constantly just repeating the same things, but the medical record's in English. And so the physicians you're working with, they'll speak English. So that is like the one saving grace is that you can at least communicate with your colleagues. I did see one other question here about the graduation renewal. When I say it helps with graduation, like the year of graduation, it's just because you have that recent clinical experience. So those programs that are evaluating holistically, which is something that we're advocating for strongly, for residency programs to evaluate patient or people based off not just your graduation, but also based off their recent clinical experience, it will help you with those programs. And yes, PR is paradise. And they do not require step 3. They require step 1. Some of the people I'm in my internado with only have step 1. So step 2 is a plus. Step 3 is a really big plus. The program director was like, wow, you have step 3. Okay. I'm sure that helped me get selected into the internado here. Spanish with Paul. I also do Pimsleur Spanish, Duolingo, of course.
I will add, yeah, Duolingo is amazing. Something that Caleb said, which is really awesome. So I live in Yuma, Arizona. I work in San Luis, Arizona, which is a border city. I didn't know any Spanish coming here, but 3.5 years, 4 years being here, 90% of our clientele is Spanish speaking and only Spanish speaking. You just, have no shame. Learn as many vocabulary words as possible. Use apps like Duolingo and just put yourself out there. You'd be surprised at how accommodating so many of especially the elderly patients, they have a good time with you, and you'll learn new words and whatnot.
Yeah. A friend of mine also told me that Fiverr, if you guys use Fiverr, the freelance website, you can find a teacher, a dedicated teacher for like $10 to $5 an hour. So that might help.
Not bad. Yeah, just to piggyback on what everybody said about just at this time while you guys are going through, applying for different licenses, trying to get a job, I'd say also like get involved, do something. I remember, there were many times where I'm emailing, House of Reps, senators in my area. I even got a meeting with one of my senators, wrote a letter to the governor. I got a response from that, who sent me to the Board of Medicine because they didn't understand what it meant to go unmatched. So part of it is say something, like don't just be quiet, join organizations that are helping. There's AMG, you can join ASP as well. Follow us on Twitter, retweet things that's going to put light on this issue because it is a huge issue. And I was talking to Anna recently about this, just that we had a recent advocacy meeting in my program about residency support situation kind of came up where it's like, well, we need more residents. And I was asking this lady who works closely with a lot of senators on the Capitol, and she was saying that it's really going to be hard to move a needle on this, but the more we put it out there, the more people start to understand what the problem is, the easier it is to start getting things kind of going. So I would just say, you guys get involved. That way more people are working, and that can help move the needle on this issue. Yeah. And thank you all guys for joining and all those questions. See if there's anything else.
I'm also posting the WIMG email if anybody's in Washington State and wants to join. You guys can join as well.
Yeah, so can everyone hear me okay now? Okay. ASP is where you can join us, and then you can, if you don't want to join as a member, you can at least sign up for the email list. And then email us at info@asphysicians.org. We'll try to connect you to whoever we can. And if you get any of these licenses in any of the states, please reach out to us because we do have an AP WhatsApp community that's with the National Association of Assistant and Associate Physicians. A lot of job opportunities are posted there, especially now as people have matched and are moving on to residency. If they were working in any of these states, their jobs will be available to for you to fill in. And it's a big community. We also talk about the bills that are passing in each state, especially in Missouri, and how you can join the advocacy efforts. And of course, Caleb is running an amazing group with Alliance of Medical Graduates where they work solely on advocacy efforts and have done a tremendous job keeping everyone aware about that stuff. So there's a lot of opportunity at this time. I cannot post the link for the AP WhatsApp group. It's a private group because we verify who is licensed. So once you have that license, I will connect you to whoever can add you to that. The recording will be posted on our website and YouTube, as I said before. Let's see, is there anything anyone else would like to discuss or add on before we close this session? We do still have about 10 more minutes. All right. If I see any questions you can answer that, but I might obviously a little slow. You're muted. Yeah. Okay. So we will conclude this, and of course, reach out to us for any other questions at info@asphysicians.org. If either of you want to give out your personal email or anything, if someone wants to reach out, or ASP email, or AMG email, you can. And if you're really passionate about this and want to get this passed in your own state or work on it, please join in some capacity for ASP or AMG. The more people we have working on this, the better, because I feel like right now, Walia and Caleb could probably attest to this. There's like a handful of us that are all dipping our hands in different pots and working together. But the more support we have, the better this will be for all of us. All right? All right. Yeah.
Thanks for having me.
Thank you, everybody.
Thank you, guys.
Stop the recording.